Hello, I'm Dr. Robert Fawcett, and I'd like to tell you about my new book called Calming the Bipolar Storm, a guide for patients and their families. It's coming out April 28th of this year, 2021. So let me tell you a little more about the book itself and how it might be of help to you. I start off discussing what is bipolar disorder, going back to some history from the ancient Greek physicians and through the Middle Ages into the 1900s when the term manic depressive illness was coined. Then we come up to the modern era of our current definitions of bipolar disorder and the various subtypes, such as bipolar 1, bipolar 2, cyclothymic disorder, and bipolar spectrum disorder. I also discuss the differences between bipolar disorder and schizophrenia, borderline personality disorder, and attention deficit hyperactivity disorder, all disorders that sometimes might be confused with bipolar disorder. Next, I talk about the causes of bipolar disorder. We go back to the twin studies of the 1900s that showed there was a very robust genetic factor playing a role with bipolar disorder. And we talk about some of the modern research uncovering some of the dozen or more genes that seem to play a role in bipolar disorder and other mood disorders. I talk about some of the triggers for manic or depressed episodes, things such as sleep deprivation or substance abuse. We talk about the role of adverse childhood experiences in causing more symptoms in bipolar disorder or making the course of it more difficult. Next, I turn to a chapter called Maintaining a Healthy Baseline, in which I discuss ways that healthy living habits can improve mood stability and act to help calm the bipolar storms. We emphasize 5 areas: sleep, exercise, diet, having a supportive social system, and avoiding substance abuse. So in that chapter, I do get into some specific suggestions about diet patterns and exercise patterns that can help improve mood stability. And we get into the actual treatment of bipolar disorder. I started with emphasizing the need for finding a treatment team that is compatible and can be trusted, because that's really essential in long-term treatment. I talk about the treatment of mania and mixed states. This usually involves lithium or some of the other anticonvulsant type mood stabilizers, and sometimes the antipsychotic medicines. I discuss these medications and their potential side effects in quite a bit of detail. There's a chapter for bipolar depression, because this is an area where we've had lots of advances the last few decades, with 4 new medications approved by the Food and Drug Administration. There's also treatments on the horizon, such as ketamine and esketamine nasal spray. There's neuromodulation techniques borrowed from the treatment of depression, things such as transcranial magnetic stimulation, vagal nerve stimulation, and electroconvulsive treatments. I talk about also some of the nutritional supplements, some of which have shown promise in aiding the treatment of bipolar disorder, and some others not so much. I have a chapter devoted to the maintenance treatment of bipolar disorder, how to stay well once one is out of an episode of depression or mania. Sometimes part of that maintenance treatment may involve psychotherapy, and there's a chapter specifically for that, which is also an aid in the treatment of bipolar depression, as well as in helping to prevent relapses of bipolar disorder. After some of the chapters on treatment, I discuss some specific areas such as pregnancy, suicide, associated disorders, because there are many psychiatric disorders and medical disorders that cluster together with bipolar disorder. I talk about secondary mania, which is mania that's caused by a specific medical problem or by a specific drug or medication. I have a chapter for bipolar disorder in youth. At the end, I recap with a summary of ways that one can calm the bipolar storm and achieve better mood stability. So my new book, Calming the Bipolar Storm, can be obtained on the Roman and Littlefield website, and that's Roman spelled Rowman, or on Amazon.com, or from your favorite bookstore or online bookseller. So if you want an up-to-date presentation of bipolar disorder and its many current forms of treatment and some of those that are on the horizon, I would suggest you get yourself a copy. You can even pre-order copies before the publication date. Thank you.